and it has been proven over the time. So now we have chosen an autoclave. Next, how do you pack your instruments to put inside the autoclave is what Dr. Ravishankar is going to talk upon.
Namaskar and good afternoon. It is indeed a pleasure to be here and present at the AIOS. It's a proud moment. At the outset, I would like to thank Dr. Kumaran Murugesan, our chief instructor, and the co-instructors for giving me the opportunity. As he rightly said, we have learnt about autoclave and next how to pack it. Yeah, having a good bath and cleaning ourselves and then wearing a good dress. A dress which is perfect, which fits in correctly. And thank you once again. How do we all decide the cycle and program of the loads in which what autoclave has to be done? Actually speaking, I would feel it is an art. Every step what we do in autoclave, every step what we do in the operation theater protocols is an art. Once we start liking it, we would start loving it. Once we start loving it, we will almost perform the duties in operation theater perfectly like how we do what we do at home daily. There are multiple types of packaging materials, and there are few materials which should allow steam to penetrate into them. When it comes to steam autoclave, the following materials like paper, plastic, cloth, fabric, paper plastic peel packages, wrapped perforated cassettes, all this would be very much perfect in a steam autoclave where the steam should penetrate inside. Dry heat, which we do not use much in ophthalmology and we not recommend. These are the type of packaging materials which are used in dry heat: the paper bags, aluminum foil, polyfilm plastic tubing, wrapped perforated cassettes. The chemical vapor, these are the materials where the vapor should be allowed to precipitate on the contents inside, and vapors should not react with the packaging material, and plastics should not contact the sides of the sterilizer, which is very important. The materials which are good for chemical vapors, ETO, are wrapped perforated cassettes, the paper and plastic peel packages. And we have other materials like fabric, which is woven and non-woven. And in the list of woven, there is often tencel, cotton, polyester, and which are woven in plain, twill, or atlas weave. These are different types of weaving or knitting. And tencel is a form of regenerated cellulose made by dissolving pulp and dry jet wet. And the woven fabric, there is a couple like canvas and atlas, and this is the way it is knitted or woven. You can see the depicted picture in the bottom of that. That's the way, the exact design when it is woven. And atlas, the other type of woven fabric, has a different kind of knitting or weaving. In the non-woven fabric, the types of non-woven fabric are spun bonded, heat bonded, and melt blown. And among them, these are specially made for special microbial barrier layer. It has a good tear resistance, and even with high tensile aberration, it has resistance, does not tear off, and has a special property of the dust barrier. The other spun bounded material made from high density polyethylene fibers. No financial interest since I put up the brand name over there. It's so interesting that it feels like plastic, but paper, but not a paper. Feels like a fabric, not a fabric, a very special material. It has a distinctive look and a feel. It weighs very less, very flexible. Water resistance, definitely it breathes well during autoclave. It is once again a tear resistant material. It is printable, convertible. The best part is 100% recyclable. The chemical vapor, which we were talking earlier, also has the unique ability to penetrate packaging and plastic without damaging them. That's the advantage what we have in ETO. I think my job was made easier by the previous speaker, Dr. Niranjan, who had in fact told lot of things which are there in the future slides also, which I would try to skip off fastly. And this slide clearly tells you, self-explanatory. No need to see all the S's, just keep seeing the nose, you'll understand. On one side of the column you have steam, formalin, ETO, plasma, other side cotton, polyester, paper, polypropylene, polyethylene and polythene by itself. And this is explanatory over there. Thermoform trace looks very impressive, very interesting. During the postgraduate days, we've never had these kind of extra materials. We used to have the aluminum boxes or the stainless steel ones. Thermoform makes life easier to keep the instruments much safer and the autoclaving process much safer and swifter too. I have videos. I think the audio, I would require the audiovisual team, if there is a possibility, kindly get the audio done. These are few videos which I would like to play where how you exactly place the instruments and how safe would they be compared to the older days instrument, the packaging boxes. This is the way you exactly do. I think most of you would have all these in your OT protocols, OT setup, and life becomes much easier when you start doing all this regularly, daily, so that it becomes a habit for you. This is another video which says how all you can cover it. This is one way of doing it, but still the second part of the video will show you how easy and good to pack it in a different way, so that there is a non-touch technique, no contact technique, and the sterility becomes the priority and the premium process over there. This is one way. After you pack it, you remove it. Yes, you do it. You can do it in this way also. And probably somewhere you may have to touch it. This process is much easier. It looks slightly complex. The more you start doing it, it becomes much easier. The more you see these videos, you'll understand how to fold it, how to pack it, how it is an art, as I told you in my previous slide. It is an art, how you do it. And after the autoclaving process is finished, it becomes easy inside the operation theater to just give the assistant to give it to the OT staff without touching it and without contactless, totally contactless. And there it goes. And this is another video which would show how you can fold the gown so that the surgeon or the operation theater staff would be wearing it in a non-contact way. When I saw this video for the first time, the second time and the third time, I didn't pick it up at all. It looks so complicated, but very, very easy to perform. Just keep seeing it. This is the right way to fold so that the operating surgeon as well as the OT staff would wear it in a non-contact way. Until this process, you still feel how to fold it, what way you fold it, how to pull it up, etc., etc. And once you are done, see how good it is. I have only a couple of more videos. I'll try to finish it on time. And there it goes. Easy, 2 fingers, wrist put into it, and there you go, wear it contactlessly. And there's another video to show how you can pack pack the boxes, packages. You need such kind of special, already cut and designed material for your packing. Yeah, this is another video quickly. This is not the way you should put the gowns or any OT materials inside it, because it would not allow the steam to pass on. And this is the right way. You need to allow enough space between the materials, whatever you keep over there. It's a fashion, one side by side and one above it on the opposite direction, and one once again likewise what you did the first time, so that it allows the steam to enter inside. So types of autoclave cycles, I think Dr. Niranjan went up on it, and I would not waste time. This is an animation which shows how you can pump it out, pump the air out, and push the steam inside. I really don't know what's happening. I'll stop with the videos and quickly go into this is the other video which he put up, where you pump out the air inside and pump in the steam. So this slide I would definitely would like to place upon record. If you can see, it is self-explanatory. Unsterile load. If it is liquid, or does it contain any liquid? If it is yes, go bottom. Is the container flexible and residual air inside? If it is no, can air be removed easily? If no, once again use pre-vacuum cycle. And if it is yes, likewise, because of paucity time, I don't want to go more about it. This is how it makes life easier for you. Shelf life is event related and depends on the quality of wrapping material, the storage conditions, the conditions during the transport, and the amount of handling. I would like to acknowledge the following person who contributed for this video: Dr. Rajiv Sugumaran, Dr. Chandrasekhar, Dr. Sasikumar, and Dr. Kumaran. Thank you so much, dear delegates, my co-instructors, organizing team of AOS, and I would like to invite you for the state conference, president sitting over here. The state conference this year would be at Chennai, 16-18 August. Thank you. Please join us.
Thank you, Dr. Ravishankar, for this wonderfully elaborating how the instruments has to be packed. We are slightly going to reschedule our talks because Dr. Nirmal Frederick has, his flight has been preponed.